Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's top headlines. Taking strict action against doctors who had allegedly abandoned the intensive care unit and trauma intensive care unit patients for hours for celebrating a birthday, the VN Desai Municipal General Hospital authorities have urged the Deputy Municipal Commissioner for cancelling their registration. Even though show cause notice has been issued against these contractual doctors who had left 7 ICU patients to their fate, they did not respond to the notice. 3 more people, including a doctor and a pharmacy student, were arrested here on Thursday in connection with drug use and peddling, taking the total arrests so far in the case to 13, police said. Among the arrests are 3 doctors, 6 medical students, including 4 women and a pharmacy student. The remaining persons are drug peddlers, the police further added. The Mangaluru police had first arrested Neel Kishorilal Ramji Shah, 38, an Indian origin person, last week in connection with the alleged drug peddling in his flat. Researchers have tested an artificial pancreas for use by type 2 diabetes patients. The device, which was powered by an algorithm developed at the University of Cambridge, compared to standard treatment, patients spent twice as much time in the glucose target range and half as much time experiencing high glucose levels. Around 415 million people worldwide are estimated to be living with type 2 diabetes, which costs around $760 billion in annual global health expenditure. Researchers from the Wellcome MRC Institute of Metabolic Science at the University of Cambridge have developed an artificial pancreas that can help maintain healthy glucose levels. The device combines an off-the-shelf glucose monitor and insulin pump with an app developed by the team known as the CAM APS-HX. This app is run by an algorithm that predicts how much insulin is required to maintain glucose levels in the target range. The Bombay High Court on Wednesday quashed 2 orders passed by the Maharashtra government revoking the license of Johnson & Johnson Company to manufacture, sell and distribute its baby powder products, terming them as stringent, unreasonable and unfair. A division bench of Justices Gautam Patel and SGDA permitted the company to manufacture, sell and distribute the products. The bench passed its order on a petition filed by the company challenging 2 orders of the state government, one dated September 15, 2022, cancelling the license, and the second dated September 20, 2022, ordering it to immediately stop the manufacturing and the sale of the baby powder product. The bench noted that while maintaining standards of quality and safety are of utmost importance for cosmetic products, at the same time, it does not seem reasonable to shut down the whole manufacturing process when there is a slight deviation in one of its products.
Scientists at Ningbo University have identified biomarkers that could provide an early warning system for 3 common and dangerous pregnancy complications, which are preeclampsia, gestational diabetes, and a liver condition called intrahepatic cholestasis. A team led by Dr. Sikian Chen decided to investigate whether specific changes in the microbiome detected using levels of short-chain fatty acids, metabolites which are produced following the fermentation of microbiota, could be used as biomarkers for pregnancy complications. The team recruited 112 women who were divided into 4 groups: those who experienced healthy pregnancies and those who were diagnosed with preeclampsia, gestational diabetes, or intrahepatic cholestasis. Chen and colleagues took medical histories and samples of blood which were analyzed for levels for 7 short-chain fatty acids: acetic, propionic, butyric, isobutyric, isovaleric, and hexanoic acid. 6 minutes of high-intensity exercise could extend the lifespan of a healthy brain and delay the onset of neurodegenerative disorders such as Alzheimer's and Parkinson's disease. New research published in the Journal of Physiology shows that a short but intense bout of cycling increases the production of a specialized protein that is essential for brain formation, learning, and memory, and could protect the brain from age-related cognitive decline. The specialized protein, named brain-derived neurotrophic factor, or BDNF for short, promotes neuroplasticity and the survival of neurons. Animal studies have shown that increasing the availability of BDNF encourages the formation and storage of memories, enhances learning, and overall boosts cognitive performance. Most symptoms or conditions that develop after mild COVID-19 infection lingered for several months but returned to normal within a year, finds a large study from Israel published by the BMJ. In particular, vaccinated people were at lower risk of breathing difficulties, the most common effect to develop after mild infection, compared with unvaccinated people. These findings suggest that although the long COVID phenomenon has been feared and discussed since the beginning of the pandemic, the vast majority of mild disease cases do not suffer serious or chronic long term. For the study, the team compared the health of uninfected individuals with those who had recovered from mild COVID-19 for a year after infection. Over 70 long COVID conditions were analyzed in a group of infected and matched uninfected members. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.